Hello and welcome to this presentation of Q&As by Internist about electronic health records. How can an internal medicine specialist prioritize physical examination findings in the electronic health record to ensure accurate patient care? Prioritization 1. Immediate concerns. Address any acute or life-threatening issues first. Ensure critical findings are highlighted and acted upon promptly. 2. Chronic conditions. Prioritize based on the potential impact on the patient's health and quality of life. Ensure proper management and follow-up are documented. 3. Preventative and health maintenance. Include age-appropriate screenings and preventive measures. Encourage lifestyle modifications for overall health improvement. Best practices 1. Clarity and conciseness. Ensure documentation is clear, concise, and free of unnecessary jargon. 2. Interdisciplinary communication. Use standardized templates and terminology to facilitate communication with other healthcare providers. 3. Patient-centered. Reflect the patient's perspective and preferences in the documentation. 4. Compliance and legal considerations. Adhere to documentation standards and legal requirements to protect patient confidentiality and provider liability. What standardized templates or tools can internal medicine specialists use to document and prioritize patient information in the electronic health record? Standardized templates and tools 1. SOAP notes, a widely used format that stands for subjective, objective, assessment, and plan, helping to structure patient encounters systematically. 2. EHR templates. Many EHR systems come with built-in templates for documenting various aspects of patient care, such as history, physical examination, and assessment plans. 3. Checklists and forms. Use checklists for specific conditions or procedures to ensure all necessary information is captured. 4. Clinical decision support tools. Integrated tools that provide reminders, alerts, and evidence-based guidelines to assist with decision-making and documentation. 5. Standardized terminology. Use of standardized medical terminologies such as SNOME, DCT, and ICD-10 to ensure clarity and consistency in documentation. What are the most common errors in documenting patient medical history that internal medicine specialists should avoid in the electronic health record? Common errors in documenting patient medical history. 1. Incomplete information. Failing to capture a comprehensive view of the patient's medical history, including missing past medical conditions, medications, or family history. 2. Inaccurate data entry. Typographical errors, incorrect data entry, or selecting the wrong options in drop-down menus can lead to inaccuracies. 3. Use of non-standard abbreviations. Using non-standard or unclear abbreviations that can be misinterpreted by other healthcare providers. 4. Copy-paste errors. Over-reliance on copy-pasting previous notes can lead to outdated or irrelevant information being included in the current documentation. 5. Lack of patient engagement, not involving the patient in the history-taking process, leading to missed or misreported information. How can internal medicine specialists effectively integrate patient-reported outcomes and self-assessment tools into the electronic health record? Integrating patient-reported outcomes and self-assessment tools. 1. EHR integration. Utilize EHR systems that support the integration of patient-reported outcomes, PROs, and self-assessment tools. Many systems offer modules or forms where patients can directly input their data. 2. Patient portals. Encourage patients to use patient portals to complete questionnaires or self-assessments prior to appointments. This information can be automatically populated into their EHR. 3. Standardized tools. Use validated and standardized PRO, patient-reported outcomes, measures that are compatible with the EHR system, ensuring consistent data capture and interpretation. 4. Regular review. Regularly review and update the PRO's patient-reported outcomes in collaboration with the patient to ensure the data remains relevant and accurate. What training and education programs are available for internal medicine specialists to improve their skills in documenting comprehensive patient medical history in the electronic health record? Training and education programs. 1. EHR vendor training. Most EHR vendors offer training sessions and resources to help healthcare providers learn how to effectively use their systems for documentation. 2. Continuing medical education, CME courses. Various CME courses focus on improving documentation skills, particularly in using EHRs effectively and efficiently. 3. Workshops and seminars. Attend workshops and seminars that focus on best practices in medical documentation and EHR usage. 4. Online courses and webinars. Many organizations and universities offer online courses and webinars that cover EHR documentation techniques, including the integration of PROs. 5. Peer learning and mentorship. Engage in peer learning opportunities or seek mentorship from colleagues who are proficient in EHR documentation to share strategies and insights. What are the key differences in documenting patient medical history between internal medicine and other specialties in the electronic health record? Key differences in documenting patient medical history. 1. Scope and detail. Internal medicine focuses on comprehensive and detailed documentation, covering a wide range of organ systems and complex chronic conditions. The history often requires integration of multiple comorbidities and a holistic view of the patient's health. Other specialties may focus more narrowly on specific systems or conditions relevant to their field. For example, cardiology might emphasize cardiac history, while dermatology may focus primarily on skin-related issues. 2. Interdisciplinary coordination. Internal medicine often acts as the primary coordinator of care, requiring detailed documentation that facilitates communication between multiple specialists and healthcare providers. Other specialties. Documentation might be more specialized and focused on specific interventions or treatments, with less emphasis on coordinating care across different disciplines. 3. Preventive and chronic care management. Internal medicine emphasizes preventive care and long-term management of chronic diseases, requiring detailed tracking of lifestyle factors, preventive screenings, and medication adherence. Other specialties may prioritize acute interventions or specialized treatments, focusing documentation on specific procedures or therapeutic. How can internal medicine specialists ensure patient confidentiality and data security when collecting and storing sensitive medical information in the electronic health record? Ensuring patient confidentiality and data security. 1. Access controls. Implement strict access controls to ensure that only authorized personnel have access to patient information. Use role-based permissions to limit access according to job responsibilities. 2. Data encryption. Use encryption for data storage and transmission to protect sensitive information from unauthorized access. 3. Regular audits. Conduct regular audits of access logs and data usage to identify and address any potential breaches or unauthorized access. 4. Training and awareness. Provide regular training for staff on data privacy regulations, such as HIPAA, and best practices for maintaining patient confidentiality. 5. Secure communication channels. Use secure and encrypted communication channels for sharing patient information, both within and outside the healthcare facility. What are the best practices for internal medicine specialists to stay up to date on electronic health record software updates and changes in medical documentation standards? Staying up to date on EHR software updates and documentation standards. 1. Vendor communication. Maintain regular communication with EHR vendors to receive updates on software changes, new features, and best practices. 2. Professional organizations. Engage with professional organizations that provide resources, guidelines, and updates on medical documentation standards and EHR usage. 3. Continuing education. Participate in continuing education courses, webinars, and workshops that focus on EHR updates and documentation techniques. 4. Internal training sessions. Organize internal training sessions to disseminate knowledge about updates and changes in documentation standards to all staff members. 5. Feedback and improvement. Encourage staff to provide feedback on EHR usage and documentation processes and use this feedback to continuously improve and adapt to changes. By focusing on these areas, internal medicine specialists can ensure effective documentation, maintain patient confidentiality, and stay current with evolving EHR technologies and standards. Adjust. What are the unique challenges internal medicine specialists face when documenting patient medical history in electronic health records compared to other medical specialties? How can internal medicine specialists balance the need for comprehensive patient documentation with the risk of data breaches and cyber attacks in electronic health records. What strategies can internal medicine specialists use to effectively incorporate electronic health record updates and changes in medical documentation standards into their clinical workflows? Unique challenges in documenting patient medical history for internal medicine specialists. 1. Complexity and volume of information challenge. Internal medicine specialists often deal with patients who have multiple comorbidities, requiring comprehensive and detailed documentation of complex medical histories. Comparison. Other specialties may focus on narrower areas, allowing for more streamlined documentation. 2. Interdisciplinary coordination challenge. As primary care providers, internal medicine specialists must document information that facilitates communication and coordination with other specialists and healthcare providers. Comparison. Specialists may focus more on documentation pertinent to their specific area of expertise, with less need for broad coordination. 3. Preventive and chronic care management challenge. The need to track preventive measures and manage chronic conditions over time requires continuous updates and detailed records. Comparison. Acute or procedure-focused specialties may not require the same level of longitudinal documentation. How should a doctor balance comprehensive documentation with data security? 1. Role-based access control. Implement role-based access controls to ensure that only authorized personnel have access to specific types of information, minimizing the risk of unauthorized access. 2. Data minimization. Adopt a data minimization approach, ensuring that only necessary information is documented and accessible, reducing the risk exposure in case of a breach. 3. Regular security audits. Conduct regular security audits and vulnerability assessments to identify and address potential weaknesses in the EHR system. 4. Employee training. Provide ongoing training on data security best practices and the importance of maintaining patient confidentiality to all staff members. How can a doctor incorporate EHR updates and documentation standards into clinical workflows? 1. Continuous education and training. Engage in continuous education and training programs to stay informed about EHR updates and changes in documentation standards. 2. Change management processes. Implement structured change management processes to smoothly transition to new EHR functionalities and standards, ensuring minimal disruption to clinical workflows. 3. Feedback mechanisms. Establish feedback mechanisms to gather input from clinicians and staff on EHR usability and documentation processes and use this information to improve workflows. 4. Customization and integration. Work with EHR vendors to customize and integrate new features in ways that align with existing workflows, ensuring that updates enhance rather than hinder clinical processes. 5. Pilot testing and phased implementation. Conduct pilot testing of new EHR features or documentation standards in a controlled environment before full implementation, allowing for adjustments based on real-world feedback. What strategies can internal medicine specialists use to stay up to date with evolving electronic health record standards and guidelines, and how can they integrate these changes into their clinical workflows? Strategies for staying up to date with evolving EHR standards and guidelines. 1. Continuous education and training. Engage in ongoing education through courses, webinars, and workshops specifically focused on EHR updates and medical documentation standards. Many organizations and universities offer such programs online, making them accessible and convenient. 2. Professional associations and conferences. Participate in professional associations related to internal medicine and healthcare IT, which often provide resources, publications, and conferences that cover the latest developments in EHR standards and guidelines. 3. Vendor communication. Maintain regular contact with EHR vendors to receive timely updates on software changes, new features, and best practices for integration. Many vendors offer training sessions and support to help users adapt to changes. 4. Peer collaboration and networking. Collaborate with peers and colleagues through professional networks and forums to share insights and strategies for integrating EHR updates. Peer learning can be an effective way to understand practical applications and solutions. 5. Reading industry publications. Subscribe to industry publications and journals that focus on healthcare IT and EHR developments. These sources often provide analyses and expert opinions on emerging trends and standards. How can internal medicine specialists effectively implement new electronic health record features and functionalities into their daily workflows? To effectively implement new electronic health record (EHR) features and functionalities into daily workflows, internal medicine specialists can adopt the following strategies. Strategies for effective implementation. 1. Thorough needs assessment. Conduct a comprehensive needs assessment to identify specific areas of the workflow that could benefit from new EHR features. Engage with staff and clinicians to gather input on functional gaps and workflow inefficiencies. 2. Pilot testing. Implement new features in a pilot phase with a small group of users to test their functionality and compatibility with existing workflows. Collect feedback and make necessary adjustments before a full-scale rollout. 3. Customization and configuration. Work with EHR vendors to customize and configure new features to align with the specific needs and preferences of the practice. This can enhance usability and ensure that the features integrate smoothly into existing workflows. 4. Training and education. Provide comprehensive training sessions for all staff members to familiarize them with the new features. Emphasize practical applications and offer hands-on training to boost confidence and competence in using the new tools. 5. Change management. Implement a structured change management process to manage the transition. This includes clear communication about the benefits and goals of the new features, as well as providing support and resources to address any concerns or resistance. 6. Ongoing support and feedback. Establish a feedback loop to continuously gather input from users on the effectiveness and usability of the new features. Provide ongoing support and troubleshooting to address any issues that arise. 7. Integration with existing workflows. Ensure that new features are seamlessly integrated into existing workflows, minimizing disruptions. This may involve adapting current processes or developing new protocols to leverage the full benefits of the features. 8. Regular evaluation and improvement. Conduct regular evaluations of the new features' impact on workflow efficiency and patient care. Use data and feedback to make iterative improvements and enhance overall system performance. How can internal medicine specialists effectively train and educate their staff on using new EHR functionalities to improve patient care? To effectively train and educate staff on using new EHR functionalities, internal medicine specialists can utilize the following strategies. Strategies for effective EHR training. 1. Comprehensive training programs. Develop and implement comprehensive training programs that cover all aspects of the new EHR functionalities. This includes hands-on training, tutorials, and exercises to ensure staff can confidently navigate the system. 1. 2. Role-based training. Tailor training sessions to the specific roles and responsibilities of different staff members. This ensures that each team member learns the functionalities most relevant to their daily tasks. 3. Use of certified EHR trainers. Employ certified EHR trainers who can provide expert guidance and support, helping staff understand the nuances of the system and how to integrate it into their workflows. 4. Pilot sessions. Start with pilot sessions where a small group of staff members test and provide feedback on the new EHR functionalities. This approach allows for troubleshooting and refinement before full-scale implementation. 3. 5. Continuous learning and support. Offer continuous learning opportunities and ongoing support to address questions and challenges as they arise. This includes regular refresher courses and access to support resources. 6. Feedback mechanisms. Establish feedback mechanisms to gather input from staff on the training process and EHR usability. Use this feedback to make improvements and better address staff needs. 7. Integration with clinical workflows. Ensure that training includes practical examples of how the new functionalities integrate with existing clinical workflows. This practical focus helps staff see the direct benefits and applications in their daily tasks. 8. Regular updates and communication. Keep staff informed about any updates or changes to the EHR system. Regular communication ensures that everyone is aware of new features and enhancements. Thank you for listening.